All right, so today we have a patient who needs to have furosemide given through his PICC line. So what I'm going to do is draw it up over here before I go into the patient's room. So that's what we're going to do. I have my saline flush for before, I have a saline flush for after, and I have my medication syringe, which I'm going to draw up here with my needle. My dose is 20 milligrams, and I have here 40 milligrams per 4 milliliters. So if I was going to do the math on that, I would cross multiply and divide 4 times 20 divided by 40, and I would get 2 milliliters. So I'm going to drop 2 milliliters of medication for this patient. All right, so I'd wash my hands, and I'm going to drop this medication. Top of my medication board. All right. All right, so I'm sitting right at 2 milliliters there. There's no air bubbles. And so I'm gonna ignite my safety. And then I'm gonna label this syringe with some tape so that it looks different from my syringes so I don't get those mixed up. And I would write on the syringe what the medication is, my initials, and the dose, just so there's no confusion. All right, so I have this labeled and I have my flushes. I'm going to take an alcohol swab and I'm going to go see my patient. So knock, knock, knock. Hi there, my name is Sarah. I'm going to be your student nurse today, and I have some furosemide that we're going to give through your PICC line here. Furosemide, what this medication is for is because you have some edema on your lower extremities, and we're going to work on trying to get some of this fluid off of you. So I'm going to get some gloves on. Already done hand hygiene. All right, can I get you to tell me your name and date of birth? And then I'm also going to ask you if you have any allergies that you know of. All right, so now that I've checked his name and allergies, I'm going to go ahead and pick the port here and start getting it cleaned off. So I'm going to go ahead and give this a good cleaning for about 15 seconds, making sure I really scrub that. All right. I'm going to hook up my saline flush, unclamp it, and I'm going to flush just like 3 or 4 milliliters to make sure that this line is patent and clear. So everything looks good, there's no infiltration. There's no redness around the site. So I'm going to go ahead and disconnect this. Dispose of this needle, which I would have done earlier in the sharps container. I'm going to hook up my furosemide medication here. All right, so for this medication, I'm going to push it slowly over 2 minutes. And while I'm pushing it, I'm going to talk to my patient here about some possible side effects of the medication. So you could have some dizziness, nausea, vomiting, and it can cause hypokalemia. So it's really important that you can eat foods that are potassium rich, so like bananas, avocados, stuff like that. Everything like that's fine. So I've flushed this over 2 minutes. I'm going to clamp my port. Clamp my line, and I'm going to disconnect, and I'm going to grab my second saline flush without contaminating or touching the port. I'm going to hook it up, unclamp, and then I'm just going to give a good 5 milliliters just to make sure this line is clear. going to reclamp the line and disconnect. So at this point, the medication is given. I'm going to dispose of all my sharps. They're going to go in the sharps container. All my syringes are going to go in the garbage. I would discard my gloves, wash my hands. His call light is right here within reach. His bed's low and locked position. And I would go document what I did.